Hi everybody, I'm going to talk to you today about the rehab that has to be done on your pet that had recent surgery. Mainly we'll be talking about the physio manipulations that can be done after knee surgery. So a lot of our pets here have had knee surgery, and I just want to make sure that you're at ease with what you're doing at home. Okay, so these are just indications of how you can do this. The main thing I would say is to choose a place that's comfortable for you and for your pet. Needs to be a quiet and calm space and moment of the day as well, so that you can have full collaboration from your pet while doing the manipulations. Okay, so I'll be showing you the manipulations or the mobilizations that we're doing on the knee after surgery. This is Paljo. He will gladly be our subject for today. So the effleurage massage is really just this gentle touching and lightweight pressure on the skin that you want to do from the bottom to the top of the limb or the leg. Keep in mind that a freshly shaved limb is maybe sensitive to touch and might have like skin irritations, so you really want to go gentle. And you also want to avoid the surgical wound. So in case of a TPLO, the wound will be on the inside of the tibia or the leg here. And let's say for a patellar luxation, the wound will be more on the outside of the leg. So you want to avoid that, but you can definitely go around and do this for about 2-3 minutes. This they usually appreciate since the skin is freshly shaved. It can be itchy. So yeah, this they usually appreciate. You can do this for even 10 minutes if you want, but usually 2-3 minutes is enough just to get blood flow going and get them used to touch. So you do this like that. And then you can go ahead and do the flexion extensions. So for the flexion extensions, what I usually recommend is to place a hand right above the knee and the hand below the knee. Okay, no squeezing or grabbing. Really light or almost no pressure on the joint or on the limb actually. And you want to go ahead and flex. So bring like this part to this part here. Flex as much as your animal will let you. If you feel there's a lot of resistance, then you'll just go ahead and release, or try and extend by massaging the top of the leg here, right above the knee. And then go back and do your flexion. If you can gain maybe 1 millimeter or 2 every time, that's perfect. It's normal that after surgery, especially after the TPO surgery, you won't have this much flexion, okay? If it stops here, you stop here, you go back in extension, and then you come back and you try and get maybe a little more, okay? And with time, you will get back that nice fully full flexion of the knee. Okay, so you go in flexion like this, and then go back in extension. At any point, if you feel that your animal is not cooperating, it will not be beneficial to continue, just stop and try again maybe a little later, okay? But don't insist too much. This should be relatively easy to do, okay? So again, there you go. So once you've done maybe 5, 10, or even 15 of the flexion extension, you can go ahead and do the ice. So for the postoperative phase, 3, 5, or 7 days after surgery, you will have this ice pack that you will have gotten with your release kit or that you have at home, and you want to go and apply it right on the knee. So if If it's freshly shaved, you want to put a really thin cloth on the skin to protect the skin. Surround the knee with your cold compress. There you go, and you hold that for about 5-10 minutes. If your animal cooperates like he does, then he totally doesn't mind, and you can definitely do this for 10 minutes. If you feel he's uncomfortable with the cold, you can take it off and maybe do it again for shorter amounts of times, but repetitively. Good boy. Good boy. And that's it. Then you just remove that, and your physio is done. If you have any questions at all, just call us. You're not alone in this. It should be fine. You can do it.